Hello, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today.
In this episode, I will discuss the highlights of the 2024 ACC/AHA Guidelines for Managing Peripheral Arterial Disease, PAD. This guideline was published in the Journal of the American College of Cardiology in May 2024. New guidance on the treatment of peripheral artery disease encourages collaborative vascular care. This approach addresses health disparities, gaps in medical therapy, the need for structured exercise, and good foot care. Appropriate revascularization is also emphasized to prevent limb loss. The document, from the American College of Cardiology and the American Heart Association, in collaboration with 9 other organizations, updates the 2016 guidelines. It calls for advocacy, including broad implementation of the Peripheral Artery Disease National Action Plan along with the updated guideline recommendations to improve outcomes. One major difference from previous guidelines is the emphasis on rigorous medical therapy for all patients with peripheral artery disease, regardless of clinical subset. This highlights the need for basic medical therapy and smoking cessation, which are often overlooked in favor of more dramatic interventions like endovascular or surgical procedures. New medical therapies have been introduced in the guidelines for the first time. Low-dose rivaroxaban combined with low-dose aspirin now has a Class 1 level of evidence recommendation. This is for symptomatic peripheral artery disease patients and those who have had endovascular or surgical revascularization to reduce the risk of major adverse cardiovascular events and major adverse limb events. Additionally, sodium glucose cotransporter 2 inhibitors and glucagon-like peptide 1 receptor agonists now have Class 1 level of evidence recommendations. These are for the prevention of major adverse cardiovascular events in patients with peripheral artery disease who also have diabetes, for patients with peripheral artery disease on maximally tolerated statin therapy and with a low-density lipoprotein cholesterol level of 70 mg per deciliter or higher. The guidelines now recommend proprotein convertase subtilisin, kexin type 9 inhibitors and ezetimibe as a Class 2A recommendation. The guideline addresses 4 clinical subsets of peripheral artery disease: asymptomatic peripheral artery disease, chronic symptomatic peripheral artery disease, including claudication, chronic limb-threatening ischemia, and acute limb ischemia. It also considers peripheral artery disease-related risk amplifiers, such as polyvascular disease, which involves atherosclerotic disease in 2 or more vascular beds. Depression is recognized as a prevalent comorbidity in peripheral artery disease. It is linked to an increased risk of major adverse cardiovascular events and major adverse limb events, as well as other adverse outcomes such as longer hospital stays and higher readmission rates after revascularization. The guidelines recommend using the Geriatric Depression Score and the Patient Health Questionnaire 9 to assess for depression. The guideline expands its focus on health disparities, recognizing the intersectionality between social determinants of health and peripheral artery disease disparities across race, ethnicity, and income level. It advises patient-centric efforts to address these disparities, including thorough physical examinations for at-risk populations. Longitudinal follow-up, particularly for disadvantaged at-risk populations, is emphasized. The guidelines support the broad adoption of quality measures for peripheral artery disease care and advocate for education and funding to reduce amputation rates by 20% by the year 2030, as proposed in a recent American Heart Association policy statement. Since the previous guidelines, the Centers for Medicare and Medicaid Services agreed to cover supervised exercise therapy for patients with peripheral artery disease. The updated guidelines include an expanded exercise section. Class 1. Level of evidence recommendations for supervised exercise therapy apply to those with chronic symptomatic peripheral artery disease, with or without revascularization. These recommendations also include structured community-based exercise programs with behavioral change techniques. While the evidence base is strongest for supervised exercise therapy, the guidelines also consider non-clinical settings like home, community, and neighborhood-based programs. Traditional advice to simply walk more is noted to be ineffective, and structured programs are emphasized. the importance of foot care across the spectrum of peripheral artery disease is a new and exciting addition. The guidelines stress not just preventive foot care but also the role of foot care professionals in managing patients with chronic limb-threatening ischemia. Sections on risk factors for foot ulcers and comprehensive foot assessments are included. A consistent theme in the new guidelines is collaborative vascular care, particularly team-based care for chronic limb-threatening ischemia. The recommendations reflect the multi-specialty nature of the writing committee and the realization that various experts need to work together for optimal patient outcomes. While asymptomatic patients with peripheral artery disease may not need a whole team, collaborative care is essential for those with severe disease. Different permutations of the care team might be involved depending on the complexity of the patient's situation. The goal is to improve historically poor outcomes in peripheral artery disease through teamwork.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.